As the church, we are called to direct the thirsting world to living water. However, with so much going on in the world, it's so easy to feel overwhelmed, disconnected, and like you're pouring from an empty cup. At SBC 21, we are here to help you reimagine, revitalize, and repurpose the cups you pour from while providing transformational resources. We also envision a world where every church is equipped, prepared, and unapologetic in building the beloved kingdom of God. We strengthen leaders and congregations to transform communities through leadership development, discipleship-making systems, revitalization, and real-time social justice ministry. Ultimately, we seek to make disciples of Jesus Christ to serve and heal a hurting world. So regardless of what cup you bring to the table, SBC 21 is here to help with resources full of living water. For more information, please visit sbc21.org.
Happy Thursday, everyone. I am so excited that you are joining us today. Welcome to Leadership Forward Lunch and Learn. I am Candi Cylar, Program Director with SBC 21, and on behalf of our director, Reverend Dr. Michael Bowie, I want to say welcome and thank you for joining us today. So if you're new to Lunch and Learns, Leadership Forward Lunch and Learns, this is an opportunity that we come together every third Thursday and bring you some interesting topics, something that is going to help you expand your mind or encourage your congregation, strengthening the outreach of your community, or some food for thought. So this week is like none other, or this month is like none other. We have some amazing information to share. And before I share that, I want to make sure that you all know that we do this. We've done this 10 times so far this year. And so we have one more Lunch and Learn for the year. And guess what? If you missed any of them, you can always go to our YouTube channel, which is Strengthening the Black Church for the 21st Century on YouTube. And you have the opportunity to watch every Lunch and Learn that we've had. And believe me, there have been some really good ones, really good information for you, your congregation, for your leadership, just period. Now, today, I do not want to take long because it's a lot of information that we want to share for you or with you, but I want to introduce you to, I don't know if she goes by doctor, but Fayron Epps, Dr. Fayron Epps, is joining us today to lead us in conversation to talk about, I just lost my train of thought that quick. Let me tell you, it's age. I'm just gonna blame it on my age, Fayron. Don't laugh. You're not there yet, but it's my age. But anyway, today we're talking about the disparities of dementia in our communities. And so while I'm talking and bringing on Dr. Epps, I want you to tell us where you're from in the chat. Also, it's lunchtime, so tell us what you're eating for lunch. I myself had tuna salad. Kind of boring, but it was good. Dr. Epps, did you have lunch yet? I know you've been running.
I had some boudin balls for breakfast. So that's so that should tell y'all where I'm from.
Exactly. New Orleans,
Yes.
Louisiana.
Louisiana, yeah.
Louisiana.
Balls is more
all right.
Lafayette area, but yeah.
So we got Virginia, DC, Texas, Nashville, Houston. Welcome, everyone. We are so excited to have this conversation. This is something that I know has plagued many of our families, definitely mine. And we did it on our own. It was just family. So now I really want to see how our churches can really play a part. So thank you for joining Atlanta, DC, Orangeburg, South Carolina. I'm going to turn it over to you, Dr. Epps. Take it away.
Yes, thank you so much, Candi. And y'all, thank y'all for joining us for this Lunch and Learn. And just a little bit about my background before I start showing my slides. I am a professor at UT Health San Antonio, also the endowed chair of caregiving research here. I am the founder of Alter Dementia. I'm also adjunct professor at Emory University in Atlanta. So I feel like I'm just all over the place, but I want to tell you the work that I'm talking to you all about today is my ministry. And we know when we're in ministry, sometimes it feels like we're all over the place, but it's really to serve his people, to make sure our communities, our families have what they need while they're on this journey. And so that is my work. I am a nurse scientist. I'm a community engaged researcher. So sometimes when I speak, I will be bringing up research opportunities because that's the only way that we can move things forward. That's the only way that our communities can have better outcomes is that we engage in research. And so I will go ahead and share my screen. Let's see. I just need thumbs up that it's showing. It's good?
You're all good.
All right. So for this lunch hour, we're going to speak about the role of the Black church in addressing dementia-related disparities. Before I move on, I have to just acknowledge, because I didn't do this all alone, and it takes money to do work in the community. And I have to acknowledge all of my community partners, folks I have contracts with, people that have sponsored some of our work. And so as you see, we're pretty much all over the country with this work. And again, it's all about helping out or investing in our Black community and trying to address these disparities. So I have this picture I'm going to start off with. These are members of the Black Dementia Minds group. And sometimes when we hear dementia, we hear the word Alzheimer's, and many of times we get a picture in our mind of what that may look like, that it's someone that it's old, that cannot move, they may not have their clothes on correctly, don't really be out there engaging. Well, here I show this picture of two people that are behind me. They're living fully with dementia. And so a lot of the work that I do, I talk about how we can live on this journey, how we can live fully, and how that church, our church family could be there to support us. And so this is Sister Arthena Caston and Brother Chris Tan, and they work with me a lot. They have helped me inform my programs because they have shown me a different way to look at dementia. You know, both involved in their church, both sharing the stories about how important their church, that spiritual connectedness, having that is important to them, but also having their family, their church family there for them is just as important as they're going through this journey. And we are part of a group, it's called Black Dementia Minds, where it's Black individuals that are diagnosed with dementia from across the country. They meet once a week and they just get together and talk, and they're able to share different things that's happening with them that week. There are signs and symptoms of dementia. So please reach out if you know anybody and they may benefit from this group. Reach out to me so we can get them connected. So this is why I do this, because I hear from those living with dementia. And so we're using this form dementia, and I don't want to make the assumption that everyone knows what dementia is. And many times y'all may not have heard dementia, and you've heard Alzheimer's disease. And so I just want to break this down, take a few seconds. So dementia is a decline in brain health. So you have a loss in cognitive functioning and behavioral abilities to such an extent that it interferes with your daily life and activities. So like Candi forgot what this topic was going to be about today, just for a brief second. But then it came back to her. That is fine, right? It didn't interfere with her normal daily activity. The problem would have been if it would have never came back to her. And now she's having troubles with her job performance. That's how it's interfering with her daily life and activities. Dementia is caused by physical changes to the brain. And dementia is an umbrella term, and Alzheimer's disease is one of the most common forms of dementia. So there's over 100, you can go on the internet, some people say over 300, 500 types and forms of dementia. And I just tell people there's a lot. And that's why it's so hard for them to really find a cure, because each dementia has its own pathology. And Alzheimer's disease is the most common. So dementia is that umbrella term, and there's several types, just like food. So I like to eat, it's lunchtime, we're gonna talk about food. Food is this general term, but how many types of food can we eat? There's all different types. And so I want you to look at dementia just like that. Alzheimer's disease is the most common. Then there's vascular dementia, Lewy body dementia, Parkinson's dementia, frontotemporal dementia, mixed dementia. These are some of the common ones that you may hear about. But like I say, it goes on and on and on. Vascular dementia is what really attacks communities of color. That's what we see in the Black community because of the cardiovascular diseases that are more prevalent, like our hypertension, our strokes, AFib, many strokes, let's see, chronic kidney disease, diabetes. All of those have things that interfere with your vascular system. And that puts us at risk to have vascular dementia. And so some of the signs and symptoms that you may see in someone is memory loss. So it's going to be short-term memory loss. So not what happened back when we was in college. No, they're going to be very sharp. They're going to know that. But it's going to be what happened this morning, what they ate for breakfast. Maybe a conversation from last night. So it's a short-term memory loss. Language skills are impaired, so they may have trouble getting certain words out. A word salad. They may want to say, hand me the remote control, but instead they may say, hand me the microwave. So really having problems expressing themselves. Visual perception is off, and so this is one of the reasons where we may have accidents, or their vehicle may have a lot of dents and dings in it, because the visual perception is off, the peripheral vision is getting decreased, and so now they can't see here and there, and then the depth perception as well. As they're walking, and I share this with a lot of our churches, we're famous to have that black rug in the vestibule of the church. And when you walk in, for someone living with dementia, that looks like a hole because they're unable to tell that, hey, the rug starts right here, and this is a rug. And so, I talk about that at church, but just think also in the workplace and at home. Their vision is impaired, things are changing differently, and so things may look different to them. Problem solving, so being able to problem solve, troubleshoot through things will be impaired. And it can be as simple as just like completing a task. I had one pastor said that his deacon did all of his handyman work, but one day his deacon was sitting there just holding the hammer and did not know what to do with the hammer. And the nail was right there. So again, problem solving, completing tasks, those are the things that you will start seeing some differences and some changes. Self-management, and that is taking care of themselves, bathing, being able to dress appropriately, managing also household and finances. These things, you'll start seeing some changes here. Ability to focus and pay attention. So they have a very short attention span. And so this is something that they'll change conversations, they may walk away. So you want to pay attention to that. And then last but not least, emotional or personality changes. This is something many times this happens and people are they blame it on something else, not realizing this could be related to dementia or could be some other disease pathology. But you want to pay attention when someone has been sweet all their life and all of a sudden they start cursing. We're not going to say, oh, they're getting old. They could do that. No, we really need to pay attention to that. Also, you can see that they may start withdrawing and not being so social. So these, again, I want you to pay attention to all of this. And you don't have to have all of these things to be diagnosed with dementia. What we say, you notice 2 or 3 things in this box, you want to follow up with a provider. So you can do further testing. There's many things that mimic dementia, urinary tract infection, depression mimics dementia, vitamin B12 deficiency. So there's many other things that can mimic dementia if it's left untreated. So it's so important for you to do the follow-up. So hopefully we're all on the same page, but feel free to put any questions in the chat as it relates to dementia. So I focus a lot in the Black community because there's the disparities, and I hate saying that. Every time I talk about that because I'm so tired of hearing about the disparities that exist in the Black community, and I'm hoping that my work in the community and with the churches we can change this. But we do have a higher rate of vascular dementia, and I shared the reasons why, and it's so important. Uh, Y'all, dementia does not discriminate with age. It's just not an old folks disease. We have people in their 30s and their early 40s that are getting diagnosed with dementia. And one of the main things is one of my colleagues, they're doing research in college students who are having strokes, have high blood pressure. And when we're that young, we're not thinking 20 years ahead. We're like, yeah, I feel good, whatever. I'm not taking medicine. I'm not changing my lifestyle, but not knowing that the damage is occurring in our brain. We just cannot see it. We cannot see it like we see the edema or the swelling in the lower extremities, or the darkness of your ankles. But when we see those things in our extremities, y'all, that's also occurring in our brain. So we have to think about that. Also, in the Black community, we're less likely to receive a formal diagnosis. And that's many reasons, all right? It could be many in our community don't really know what dementia is. They just blame it on old age. Like it's nothing. She's been like that all her life. Or we're like, you know what? We don't trust the doctors. We're not going there. But then in return, if you do go to the doctor, many times the doctors are dismissing our concerns. And we know this with other conditions as well, and they don't take it serious. And so we're not getting that diagnosis, and then we're not getting the help earlier that we need. So it's when I talk to healthcare professionals, I talk to them about this, right? You have to take everyone's concern seriously and really investigate it. And then for our families, I say you have to advocate for this as well. We're twice more likely than our white counterparts to have a form of dementia. And this last bullet is the statistic that just is like, Fayron, you have to do something about this. So by 2030, nearly 40% of all Americans that's living with Alzheimer's disease or a form of dementia will be Black or Latino. That's less than what, 7 years away? I don't know. When I started, I used to say that's less than 10 years. And now each year I'm like, whoa, and we're not doing anything about that. And so when I work with our faith communities, we also talk about brain health so we can reduce our risk of dementia as well. And I'll talk about that a little bit later. So we can change these numbers, hopefully make a dent by 2030, just a little bit. But then when 2040 and 50 get here, those numbers will be drastically different. And they won't be saying nearly 40%. So I do a lot in the Black church, and I would say one of the main things is I was raised in a church. I am a woman of faith. And in my research, all of the families I work with always bring up religion, bring up their pastor, bring up going to church, how important that is to them. And so we need to do something. The Black church in 2024 is still the heartbeat of many of our African American communities. I know attendance and weekly worship service may vary than what it did 5 years ago, look different, but it's still that heartbeat. And I recognize that, and I want to make sure that everybody recognize that. Our faith communities are the most trusted source of information for everything, everything. And so why not me bring this dementia programming to the church? Why not? Also, the church is a safe environment for many. And the last two bullets here are from actually caregivers. We had one caregiver said, the church is accountable for their members, for their parishioners. So if this is happening in the community, they need to develop programs to support us. And this is coming from a caregiver. And then another caregiver said the church is influential because they have such an old tradition of just being that go-to answer. The first thing we always say is pray and then go talk to the pastor. But you go talk to the pastor, but if they don't know anything about this, how can they truly help you? And again, we want to change that. I want to take action. And one of the things I say that I do this work out of love, and love is action. And so if we're saying we love our neighbors, we love our family members, we have to take action. And that's what this is. This is really, I'm hoping it's a call to action. So everybody will get on board and say, you know what, we need to do something about this. So I developed the Alter program, and it was to provide dementia-related education to African American faith communities and to equip them with the resources that they need so they can better support their members in the communities that they are serving. And when we selected the term alter, the name alter, it's really, we wanted to change how we look at dementia in the Black community, how we treat it, how we approach it. And I will talk a little bit more about that. In the beginning, I want to let y'all know this just started off with me educating me and some colleagues in the Atlanta area. We started it in Atlanta. Just educating. We found 2 pastors that opened up their church for us on a Saturday, and we will get out and we'll just educate about this because so many people didn't know about this in 2017. And so we started doing that, and we thought we was doing a good job. Oh yeah, we're just going to educate everybody, until a bishop stopped me at the end. And he was like, this was good, but I was like, but what's going on? He was like, but what do I do as a faith leader? How do I support my deacon who doesn't recognize himself in the mirror? Like, what can I do? And I did not have an answer for him. And I went back to the team and I said, oh, this is not good because we're educating. Now we're being more informed, but we're not giving the tools. We're not equipping our leaders with what they need to do within their congregation. And so we came up with this full-fledged program that I'll tell you about, give you more details, so we can better help our leaders help their members. So with our group, when we work with our faith communities, we're coming to educate, of course. We're also coming to empower. We want to empower our congregations. And because when you are educated, you can feel empowered. And now you know what to do. You can advocate, you can support others. If you're not personally affected by this, you can now support others. You can tell people what you've learned so then they can be helped. And then also altering the community's perception of dementia. So we want people to know that it's not a death sentence. A lot of people don't want to talk about it because true, it does not have a cure, but it does not mean you cannot still live fully. It does not mean that you are incapable. You can't do things now. Many times when you get that diagnosis, a lot of people just take everything away, taking the keys, we taking this, that. And no, that's not the right approach. And I want the faith community to be there because we don't want to push these members to the side and say, oh, they just need to sit in the back. There's nothing they can do, or we don't need to check on them. No, they can still do things. And we try to work with our communities to make sure we understand that, or they understand. So again, we're coming to alter our approach, alter our understanding, and alter our outlook as it relates to dementia. So how we do that, we have three-pronged approach. Is through support, education, and worship. So we want to make sure when we work with our faith communities that our faith communities are offering resources to their care partners and persons living with dementia. So again, we're equipping them so they can offer these supportive resources. Also, we're equipping them with providing education to the church and the community about dementia, about brain health awareness, anything related to dementia, diabetes education. If we learn how to control our diabetes, then we reduce our risk of dementia. And so it's so much education they can do, and including the youth is so important. And then we also speak with our faith communities and our leaders about worship. Worship has to look a little bit different for those living with dementia. For these caregivers, that's multitasking. And so we work with our leaders to see how we can reimagine worship for these families and what can we do so they can still feel spiritually supported and get that connection. So here are some examples. Let me look at my time, make sure I'm doing okay. So here are some examples of activities that our churches agree to do. They don't do all of them. So they select maybe 2 to 3 from each bullet that they can work on over a 2-year period. And so they can do memory cafes, which is just like a cafe where these families can come and just hang out. No judgment. We can paint, we can just listen to music, but it's a safe place where they can come mingle with others that's also on this journey. Support groups. We have some churches offer support groups, or they connect with other support groups that's offered by local organizations like the Alzheimer's Association. Resource library, mostly all of our churches do this. You can put some pamphlets and books in the foyer or the vestibule, and that's your library. Because people they may not come out and say, hey, I'm on this journey, but when they walking out of service, they may pick up a pamphlet, and that is great. Respite programs, that's when you're providing break for that caregiver, that care partner, and it could also be financial respite. Our caregivers, they need so much, they need support, and we need to find ways to kind of support them. And give caregiving scholarships out, supply closet for families. They can have clothes in there. It can have medical equipment, incontinent briefs, whatever you think families will need that's on this journey. So these are just examples. As we look at education and awareness, you can pick a Sunday and say, hey, this is my memory Sunday. This is my purple Sunday. You can call it whatever Sunday you want. As long as it's us and bringing awareness about this and having some way to start this conversation. I know at my church, we made stoles for our pastor. So for this Sunday, he just wore it. And it was a conversation piece. And then everybody that came in church, we gave them a pamphlet on what is Alzheimer's. So it could be something just as simple as that. Doing dementia and brain health education, and then worship. Some examples some of our churches do is shorten your service length. So if it's in person, we recommend 75 minutes or less. That was based on some research I did. But also if it's online, because I have a lot of pastors say, oh, well, we online, we good. Yo, no, 45 minutes online is still too much for a family that is experiencing dementia. And so we have dementia-friendly worship services, and we actually coach our leaders to think about how you can do sermonettes or a service that's 10 minutes and or less, and have it available for these families. High proportion of music is really, really good. Familiar prayers, using visual aids, doing worship service is important. Again, these are just examples. When we work with our faith communities, we give them a long list and they can select from. So I'm hoping that we have some members, some churches online that is so interested in partnering with us. Because we're looking, our goal is to be across the United States. Since January 2020, we have been able to partner with a little bit over 90 faith communities. We partner with individual churches. We also partner with districts or alliances as well. And we have a different framework for that. It is a 2-year partnership, and it's just 2 years for you to see, okay, how are we going to do this, right? Everything does not have to happen in those 30 days. We're looking at it over 24 months, how we can put a timeline together to achieve some of these goals so we can be recognized as a dementia-friendly congregation. We have memorandum of understanding. We provide a financial contribution to our faith communities because we want to make sure you can start this ministry and we don't have to have sell dinners or ask leadership for money. You're coming in with your own money for your ministry. It's 16 initiatives that you will agree to implement and work on. And after 2 years, you can become a legacy partner where then you can start training and partnering with other churches to get them where you are. And I will let you all know over this period of time, we have been able to invest a little bit a little bit over $150,000 back into our Black faith communities. So this is not in my pocket, no one in my team. This is going back into our communities. And to me, I share this because this is what building capacity is. Building the capacity of our churches to be able to truly serve their members in their community, making sure that they have not just tangible resources, but the financial resources as well. So these are just some pictures of our faith communities in Atlanta and Minnesota. Yeah, in Texas. I was trying to see where all these pictures are because we go out and I pop in or we come out and we support the activities that they're doing. And I also do research. And so we engage with our churches to make sure that we can develop tools and other programming. And this is just some pictures that we did, I think last year when we went to visit churches, and we were able to survey 1,350 congregants over several, I forgot the period of time. I should know this, but it was a couple of months. And I phrase it as research and worship. And so we would come to churches on Sundays and survey their members. So you may say, okay, how can you help? How can you join this movement? We ask that you stay connected. And so I'll put some links in the chat, but we do quarterly newsletters. You can become a volunteer. We need volunteers because there's no way I could be in every city like tomorrow, no, October the 19th. There's so many events going on. And we just can't be everywhere. So we look for volunteers. We're also on social media. You can become a partner. You can attend a virtual informational session. We have an application that you will fill after you complete or attend the informational session. And then you would identify the ambassador within your congregation that we will work with, and we will coach them on how to implement this program. But you also can participate in education. So we do virtual community forums quarterly. We also offer a dementia-friendly workshop. It's virtual and in person. Our next one is also this Saturday. Our virtual one we have this Saturday. But we will be coming out to certain areas. So we're coming to South Carolina over the next 12 months. We're coming to St. Louis, Missouri. We're going to be in Dallas. We'll be in San Antonio, and we'll be in Los Angeles offering some workshops. So please do reach out to me so we can make sure you're getting this information if anyone is on the call from those areas. And then we also have our Alter Dementia Summit that's held in April in Atlanta, Georgia, that we bring everybody together, and you don't have to be a partner to participate in this. This is where you can come and you can get information to bring back to your community, to your church, to your family, just to be able to have impact and help families that are on this journey. So these are pictures from the Alter Dementia Summit. So I just want to let y'all know it's not no boring summit. It's a good old time that we have. It's almost like a homecoming experience. Where you come back home to a church and you're seeing family, and this is for all denominations, and it's so beautiful to see everyone come together for one cause. So beautiful. We have a concert, plays. It's an experience. I'm gonna take Summit out. I'm gonna call it an experience. We'll show this video at the end. I also, again, this is save the date. I will put the links in the chat, but you can pre-register for the summit so you can get updates. Registration will probably fully open in December. And the summit is April the 10th through the 12th at Impact Church, is one of our United Methodist churches in the Atlanta area. I know you see that East Point City, but it's really Atlanta for those that are not in the Atlanta metro area. So I'm so excited that we'll be they're hosting us there. And if anyone on the call is a researcher, we are also asking for abstracts, because we want our community to know about the research that's being done. We want them to know about research that's being done with Black families and we want to be the first. We don't want to wait 5 and 10 years to learn about it. We want to know now so we can start making changes if we need to. Again, that's how we change those statistics and those numbers, y'all. We have to do this together. This is the flyer for the informational link. So I have a lot of stuff to put in the chat. But if you have your phone, you can screenshot this or you can use the QR code. But we have our next informational session this evening at 5 o'clock Central Time, 6 p.m. Eastern Time. Please tune in. You will have more information. We'll talk about this, but a little bit more. We go in depth. This is our website. Feel free to visit it to share with your leadership, with others that may be interested in really joining this movement. And I am done, Candi. I'm going to turn it where I think we're going to show the video, and then I'll turn it back over to you. I think I did good with time. Thank you all. And this is my contact information.
You did very good.
Greetings, Alter family! We had an amazing time at the 2024 Alter Summit. We're sad you missed the fun, but no fear. Alter Summit 2025 will be here before you know it. Here's some of what you missed.
This has been the most spirit-filled, informational summit that I have ever attended.
I'm here to make sure people don't have that fear anymore, right? That we do find a cure for Alzheimer's disease. In my lifetime, in my children's lifetime, in my future generations, that we do have a cure for Alzheimer's. But I want to make sure we know the 6 pillars of brain health. How do we reduce our risk?
Be sure to catch the next one. Save the date for Alter Summit 2025.
Put it on your calendar because this is the best thing ever.
April the 10th to the 12th. So please disregard that. But thank you for playing that video for me.
Thank you for coming on. This has been really that 40% by 2030 is alarming. It's very alarming. And so I know we've all experienced some dementia in our families and having to take care of them, but knowing ways that we can help prevent. Can you circle back to that brain function? I think you said it was 4 things. Can you circle back to that?
Yeah, it's 6 pillars of brain health. And the 6 pillars of brain health is social engagement. And so that is being engaged because depression, social isolation leads to depression, which puts you at risk for dementia. So making sure you we connect the dots. So being socially engaged, brain engagement is number 2. And that is challenging your brain, learning a new language, something that's hard, doing these exercises, playing games on your phone, but at the hard level, okay, not the easy level. So you want to challenge your brain. Number 3 is manage your stress. Right? Easier said than done. And especially with us identifying as Black, there's certain things that we're just in a stressful situation. Racial discrimination, research has shown, leads to cognitive decline. That came out about 2 years ago. So we have to be really important to manage the things that we can. So managing your stress. Number 4 is exercising. And when you exercise, you want your heart rate up, and it's perspiring. So you want to make sure that's what exercise, not leisurely walking around a corner. No, we want that heart rate to be up. Number 5 is sleeping. So they are recommending 7 to 8 hours of sleep, consistent, not us breaking it up, 2 hours here, an hour here, 30, no. 7 to 8 hours of sleep is so important. That actually removes the plaques and tangles that build up throughout the day. And so that really helps with that. And you really, if you think when you don't sleep and you don't get that sleep, you start getting quote unquote brain fog. Well, imagine you doing this for years and years on top of years. These plaques and tangles that cause Alzheimer's disease are building up. And number 6 is eating right. How done? I should have started off with that. And so, I don't recommend any particular diet. I really feel that we know what we should be eating. American Heart Association putting out a good thing, low sodium, low fat, low cholesterol. I know we come from all different cultures. And, you know, with me originally being from New Orleans, there are certain foods that are just, we eat all the time. I'm not saying I stop eating them. I just don't eat as much, right?
Mhm.
Maybe it's me having this shrimp po' boy once every 3 months versus me having it every week. Uh, and so it's things like that we want. And of course, plant-based diets are always good. That's good overall for your health. These are things that, you know, have shown in the literature, in the research. So those are your 6 pillars of brain health.
That's good. That's good. I think we have to constantly remind ourselves of the things because we can fall back into old habits or we can never come out of those habits that are not good for us. I love the idea that Black church is still a heartbeat of the community, which is the foundation of SBC 21. We want to continue to support the Black church because the Black church matters. One thing you said that really touched my heart is the person that you interviewed that said the church is accountable. There is a lot of weight put on the church, and it's a lot of weight put on the leaders, but you gave some very tangible things that we can do to support the community. Because we're all not necessarily counselors, we're all not doctors, medical doctors, but we can support in some ways. In some of those ways, you talked about the memory cafe. I thought that was amazing. A lot of our churches have spaces that are not being used. So how do you repurpose those spaces? Doing little things like having information in your vestibule, that just little stuff that will help support people. Even starting dementia support groups is amazing. And I think sometimes we just forget. Sometimes we think we're too small, we don't need it, or we can't. Every little thing counts. Every little thing helps.
Yeah.
There's a question in the chat. Are allied health professionals, for example, occupational, speech, physical, and other therapists who specialize in medical issues such as dementia involved in your organization and your work?
Yes, so we actually will have a speech therapist at the summit with us. We had physical therapy with us last year. Occupational therapy, I usually work with them with some of my research as well because they help with staging activities. But with me having that nursing background, I really truly believe in working with all professionals. And so, yes, long answer to your question. Yes. And Candi, what you were saying about with the faith communities, yes, you know, oh, we just got 40 members, we got 75 members, we don't need to do that. But
Mhm.
trust me, putting this in place, it doesn't matter how many members you have. And then you can partner. Sometimes it can be a lot. I know it's a lot on churches. And that's
Mhm.
why me and my team, we're here. We're not just saying, hey, you partner with us, we give you this and you go be great. No, we walk right alongside you over these 2 years to make sure you have the resources that you need. You can partner with other faith communities to do this together.
Mhm.
And you don't have to build everything from ground zero.
Mhm.
There's people with online. We have a Black male support group that meets online. So
Mhm.
just connecting some of your male caregivers to that group, that is a win. That is a plus.
That's that's so important, so very important. And I was thinking back to the 75-minute church worship services. That not only touches those that want to worship with patients or have a break so that they can worship and somebody else is with the patient, but just in general, the brain function of being aware of neurodivergent people. Pastors really have to think about no more than 75-minute worship. 2 hours nowadays is just, I don't know how we did it before. We did it and we worshiped real hard, but nowadays it's just not necessary because we have so many other factors to think about. So I love all of the tips and tools that you shared today. Francis in Maryland said, thanks for the helpful info on dementia. This has helped me greatly as I have a family member with this. So you have helped yet another person and persons today on this call. Take this information back to your worship communities, and we hope to see you in April at Impact Church. So I will
Yes.
plan to put that on my calendar.
Put it on your calendar, Candy. And I put in the chat, I also have a program for any caregivers that's on the line. It's called Caregiving While Black. It's a program/study. And so I put a link there, but it addresses the cultural reality of us being in America and trying to care for someone living with dementia to get the care that they need, how we navigate the healthcare system, things that we just were never told, how to speak with an attorney, get your finances in order. That's what's all in this course. So I did put that in the chat. You don't have to live with the person that you're caring for, but you just have to be contributing some type of way for someone living with dementia. And this is really a great program.
Thank you so very much for being with us today. If you all have enjoyed this time today, don't forget, we're on next month, third Thursday. All right, so upcoming, take a second, if you can grab that QR code and register for this particular webinar. So if you have not done so, subscribe and like our YouTube channel. Make sure you're following us on our socials. That's Instagram as well as Facebook. We are just elated that you have joined us for your Thursday afternoon. If you haven't had lunch, make sure that you go get some lunch and make sure you put some vegetables on that plate. We are just grateful for the time that you have spent with us, Dr. Epps, and we appreciate you. And we will see you all next month. Have a great day. Oh, and I would be remiss to not say that Fayron is a graduate of the Tuskegee University, and we have some alum that are on. I see them. Thank you for joining. The best school in the world. Okay, we can go now.
Yes, we could go now. Thank you. All right. Y'all have a great day. I look forward to hearing from many of you all.
All right.